issue is a matter of life and death, and the minister has a very good opportunity to speak to Kenyans about this. Minister, a living patient by the name of Sheila Litunya Omungala from Kakamega, Butere, working in Nairobi. She went to deliver. She had paid for SHA. She's a small mama mboga in this town and whatever. She had done her part. But at the end of the process, she was faced with a bill of 51,000, of which thankfully SHA paid around 400,000. The remaining 200,000, they told her, you must pay. Minister, this is the elephant in the room. When a poor woman like that who had played her role, she had paid. She then has to pay 200,000. Then they can't say SHA is working. Because these are the same women, when she was delivering her first and second child under Linda Mama, she just went, delivered, and went back home. But in your case, she's being challenged, despite being a member, you must pay. I want to thank the Senator of Nairobi, because I had to use his office to get to social workers for me to get that bill to be waived. Not many patients have access to us leaders.
What is your
question,
Minister,
my question?
Senator Boni?
Yeah, I had to pay it because I feel a lot of pain about Litunya.
I share your pain, but yes. Go straight to the question, Senator.
So, Minister, the question you must answer for Kenyans, this extra bill, which SHA expect people to pay, why don't you accept that it is a statement of a failed system of funding, and therefore you rework it so that patients, my dear brother, can enjoy in the same manner they were enjoying under Linda Mama. When you convert Linda Mama into Linda Jamii, that is fraud, because in Jamii, people, and Dr. Moth is there, some of the people in the Jamii have got backache, some weird things, but delivery of mothers is a serious emergency which is life-threatening. You've just told us about the 355 women who die out of 100,000 people. That should not happen. Governor Wamatangi has shown you the way in Kiambu. He has sustained 8 months without a single maternal death. It's doable. And because my younger colleague is there.
Senator Beatrice Akinyi.
Thank you, Mr. Speaker. Mine is Waziri Duale. Welcome and thank you. You are doing a good job. My question will be very simple, Waziri. This transition from Linda Mama to Linda Jamii, did we at any point lose the package of Linda Mama as you transit to Linda Jamii? Can you give us the package so that you debunk the street political fraud by Senator Khalwale, so that Kenyans, this is the only forum. We don't want Senator Khalwale to go to Malinya and mislead people that shifting from Linda Mama to Linda Jamii is a fraud. You have the opportunity to shine, Waziri. I yield.
Senator Meth.
Thank you very much, Mr. Speaker. Sir, mine is actually related to what Senator Akinyi asked, and I saw the maternal deaths report, and Nyandarua had the least maternal deaths report in the entire republic. But my question was, Waziri, since most of these facilities that we have are run by county governments, my question is, in terms of detaining mothers and their newborns, is there a policy in the ministry as to how long a mother can be detained in a hospital because they're not able to meet their bill?
Senator Mungatana.
Mr. Speaker, thank you, and thank you, Waziri, for the good job you're doing at the ministry. Mr. Speaker, We pay 2.75% of gross with a minimum of 300 shillings, or means testing is done and we pay 2.75%. Now, this is what Kenyans are paying. The question I wanted to ask you, Mr. Speaker, through the Minister, through Mr. Speaker, is that in this country, we have many other African nationalities who are living here. And maybe part of that report of deaths includes the nationalities who are living in this country from other African nations. I represent this Senate in the Pan-African Parliament. And the question is, are people covered, those who are not paying, like those who are not paying SHA now, are they covered in this Linda Jamii? What do we do with them? How do you take care of the Congolese, the Zambians, the Ethiopians, and everyone who is living here? Your system of registration says *.147#, and if you go down, the next is your ID number. These people don't have ID numbers. What do we do with them? They are with us here. They are still going to give you those maternal deaths. What do we do with them? What is the stand of the Kenya government on this matter? Thank you, Mr. Speaker.
Senator Nyutu.
Thank you, Mr. Speaker, for the opportunity. And allow me to just remind Waziri that the duties under the ministry that he has are very massive, Mr. Speaker, because you can live without an education. You can actually live, you can actually borrow some food from a neighbor, but you can never borrow health from a neighbor. You cannot live without good health. Mr. Speaker, I'm just trying to tell the CS that he would do better to work more than he does politics. That having been said and done, Mr. Speaker, I want to ask the CS, he has in his response about Linda Mama, he has said that they transited from Linda Mama to Linda Jamii. And one of the benefits that according to the response by the CS, one of the benefits then becomes, Honorable Minister, what is the ministry doing to see to it that there is prevention of teenage pregnancies in order for us to do prevention, because we have always been told that it is better than cure? That's my question, Mr. Speaker. Thank you.
Senator Gataya, more fire.
Thank you, Honorable Speaker. My question is very simple. What is the fate of thousands of Kenyans who cannot afford to pay SHA for themselves? Honorable
CS, you may now proceed to respond.
Thank you, Mr. Speaker and members. Let me start with the question by Honorable Senator for Uasin Gishu and the chair of the Health Committee. Yes, the matter was very unique to MTRH. That issue we have resolved. Those mothers who had, mainly they had no IDs, and but we made our own internal contingency, and SHA has paid, and we have told the CEO and the current leadership at MTRH that that should not happen again. The question to my former colleague and senior Senator Boni Khalwale, and Senator Boni Khalwale, I will not take the advice of the Senator for Nandi, because I'm here to answer questions from senators in either form. Senator Boni Khalwale is also a medical doctor. I think the case you have mentioned first must be a very complicated case of delivery for it to reach that level of 600,000. So that was a very complicated case. And SHA covered 60% of the bill. And this must be very clear. Even during the NHIF, there was no full coverage for NHIF. So SHA will cover the bit that is required by law for SHA to pay. There's nowhere where you have to pay 100%. I mean, even myself talking, I have patients. And if the bill is $1 million, SHA pays 700, then the other 300 is an obligation on the part of the family members and relatives of that patient. So, and I think we did our bit. If I go to Linda Mama, first there's no Linda Mama that exists. A transition was done, a more comprehensive, better Linda Mama is now anchored in SHA. And Honorable Speaker, I said it when I was answering the question. And in the answers that I have given to the Honorable Senators, if you look at it, there's a table. And I'll give you an example. Linda Mama, for level 2 and 3, were paying 2,500. For level 4 and 5 and 6, it was paying 5,000. And in fact, there was no equity. They were paying more for faith-based and private, and less for public. The highest they have paid for cesarean was 17,000. Today, under SHA, it's more expanded, more comprehensive. Any delivery that takes place in our country, if you are registered under SHIF, SHA will pay 10,000. From the 2,500 of Linda Mama. So Linda Jamii is paying 10,000. For cesarean, we have moved from 17,000 to 30,000. That is progressive. And it covers comprehensively. For Linda Mama, it was only, Honorable Senators, through the Speaker, it was only for delivery. But for Linda Jamii, it is everything, surgical, anything that that mother and her child will require, even the treatment of post-delivery. Under Linda Jamii is very comprehensive. I have given the data, and you can look at it. 2, it was budgeted, so the budget was not predictive. We inherited 4.2 billion shillings debt of Linda Mama. Today we will not inherit anything. Today we have no bill. Every mother in our country, and about 1.2 million mothers deliver in our country annually. We can give you those who go through SHA. Since SHA inception in October last year, are close to about 690,000. There are many who are delivering maybe at home. There are many who are delivering in private hospitals and paying for themselves. So my senior Honorable Khalwale, this mother could have had a bill of 500K paid, and I'm sure the balance the family will. But I think those are rare cases, are very complicated cases. No more delivery, no more cesarean. You are a doctor. You can do better. Again, with Honorable Mandago, let me just read the package, the SHA package, benefit package, that covers normal delivery at 10,000, and this package includes all that you require: medicine, drugs, procedures. This was not found in Linda Mama. It can only be found in Linda Jamii. So Linda Mama has transited to a more comprehensive healthcare delivery system for our mothers. If a mother exceeds 3 days, as he said, the SHA package reverts to a duly bed rebate, which is found in the law that you have passed. So if a mother stays over 3 days, the hospital is to notify through our system, the SHA leadership and officers, and they will do it. Honorable Senate Minority Leader, I agree with you. We have a serious problem in the implementation of the primary health care.